Here's a medical thing they don't tell you. Sometimes when you're going to the hospital late at night, you might run into a resident who's been working a 30-hour shift. That means they get in at 7 or 8 a.m. and they're leaving the next day at 1 or 2 p.m. Now, thankfully, I don't have to do that anymore since I'm past residency, but what that would look like for me personally is I would wake up, get to work, have my first cup of caffeine, try to nap between 3 to 4, maybe 3 to 5 p.m., and then start admitting patients later on that afternoon. If the night was uneventful, there weren't any codes, maybe you could go back to sleep at like 2 a.m. till 6 a.m. But if a code blue happens or another emergency happens, you're the one that's on call, you're the one in the hospital that has to respond to that. So needless to say, that's probably the time in my life where I consume the most amount of caffeine. And again, it's difficult to stay awake and then try to be sharp for that long of time, especially when you're taking care of people in their most serious moments of life. Some residency programs are ending that entirely and they're just doing 12-hour shifts, but other programs argue that you lose continuity of care if you don't have the same resident on for the 24 to 30 hours. Again, up for debate, but sometimes you feel like, should it really be up for debate?